Good afternoon. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership and Professor of Medicine at Harvard Medical School. And thank you for joining us. There are over 700 registrants today for our discussion on applying to residency, and this includes students, faculty, administrators across many schools and organizations. Today's webinar is sponsored by the Harvard Medical School Office for Diversity, Inclusion, and Community Partnership, DICP. The mission of DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identifies and trains leaders in academic medicine and health policy, and provides programs that address crucial pipeline issues. Today's program is the first webinar in our 2021 Visiting Clerkship Program webinar series. For 30 years, the Visiting Clerkship Program, VCP, has been a model of excellence, offering outstanding medical students, particularly those from groups underrepresented in medicine, an opportunity to participate in externships at Harvard Medical School and its affiliated hospitals. Since inception, 1,583 students have rotated through the Visiting Clerkship Program. However, the VCP has been drastically impacted by COVID-19. We recognize that there's a lot of uncertainty in what the upcoming application cycle for residency might look like. And with this concern in mind, we are hosting a series of webinars to bring members of our HMS residency programs and medical students together to share ideas, provide support, and address questions on transitioning to the next stage of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, as well as other concerns that students might have. Before we begin, a few housekeeping notes for today's session. The chat is not available. Microphones will be muted, but you can use the Q&A to post questions to panelists. This webinar is recorded and will be posted on the DICP website. And now it's my pleasure to introduce Dr. Alden Landry. Dr. Landry is an emergency medicine physician at Beth Israel Deaconess Medical Center, an assistant professor of emergency medicine at Harvard Medical School, and assistant dean in the Office for Diversity, Inclusion, and Community Partnership at Harvard Medical School. I now will turn this over to Dr. Landry. Thank you.
Thank you, Dr. Reed, for that introduction, and thank you to all of the panelists for being here, and most importantly, thank you to all the students for joining us today. We are excited to restart our virtual webinar series discussing the Visiting Clerkship Program, as well as opportunities for training here at Harvard Medical School and its affiliated institutions. We're excited to have you here. I think the panelists that you all will be hearing from over the course of the next hour or so are going to really really answer those questions that a lot of students are having right now because of that uncertainty that Dr. Reed mentioned in relation to visiting clerkships, away rotations, in the overall process of applying to residency, as we're now going to be entering into our second application season that's going to be impacted by COVID-19. There's a lot of changes that are happening to the application process, and we'll try and parse through those as best we can. But we want you to understand that these are discussions that we're having that are specifically related to our institution. We defer to ERAS and to NRMP as there may be changes that happen that we can't necessarily predict. But the information that you're going to receive is from individuals who are experts from their medical education roles, and will be sharing with you their thoughts and insights based off of the information that we have now. As Dr. Reed mentioned, the chat function is closed, but if you do have questions for the panelists, please put those into the Q&A function, and I will be perusing those while we're going through our discussion to make sure we bring in the topics that you all feel are most needed for us to bring to the forefront of this discussion. Again, our goal is to try and answer as many questions to help you all feel comfortable and confident with the application process, and hopefully as a way to use this as a recruitment tool, because we'd love to see you here as a part of our trainees in future years. and as a part of our Harvard community. With that, I want to introduce our panelists. We're going to go first to Dr. Sidhu Gangadharan, who is a Chief of Thoracic Surgery and Interventional Pulmonology. He is the General Surgery Residency Program Assistant Director and the Cardiothoracic Surgery Residency Program Director. Next is Dr. Natasha Johnson. She is an Associate Professor of Obstetrics and Gynecology and Reproductive Biology, and she is the Associate Director and Principal of the Principal Clinical Experience at Brigham and Women's Hospital. And then last but not least is Dr. Nicte Mejia. She is an Assistant Professor of Neurology at Massachusetts General Hospital. And with that, I will start to open it up for our questions for our panelists. And my first question is for you, Dr. Johnson. So Nicki, can you tell me a little bit about the overview of the process for applications this year? What is ERAS going to look like for this application season?
Sure. Hi, everyone, and welcome. We're really excited to be here with you today and have these conversations. So ERAS this year is a little bit different from in past years. In January, they opened it up for applicants who are applying in this next cycle to be sent their numeric token. And so your medical school would have registered you, and then you should have gotten an email to register this token to gain access. If you didn't do it by April 15th, it should have been sent again. And once you're registered, what that means is that you can start filling out your personal information and request letters. Then on June 9th this year, ERAS is going to fully open. And so that will let you complete the CV portion of the application, upload your personal statement and other documents. And then September 1st, applicants can then begin applying to programs. So this is when you want to make sure to have your list ready. And it's the first opportunity where you actually can certify and then submit your application. Also new this year is it's a little bit earlier. By September 29th, your medical school, your Office of Student Affairs needs to have uploaded your dean's letter, or what's called the MSPE. And then on that same day, September 29th, programs can start to view your application. So what's nice about that is it's all consolidated on one day. And so for you as an applicant, it will kind of streamline things and there won't be as much time to wait because it'll all be the same deadline. So I think that's a really positive change that's happening this year.
You know, it's interesting, Nicki, because what you're telling us is a little bit different from years past in that, you know, applications would be due September 15th, and then the dean's letter, MSRP, would come out a little bit later on October 1st. And so it seems like they're really trying to make it more of a streamlined process. And I think that's going to be helpful for students. Sidhu, I had a question for you as a program director. Speaking from your perspective, what are your overall thoughts about this season and how you as a program director are planning to prepare for this application season?
Well, we, in the cardiothoracic world, we've had now 2 cycles where we have done virtual interviews. On general surgery, we did in-person interviews before the pandemic, and then this past season we did virtual interviews. So I think we've got a lot of experience on how to handle that. I mean, I think from our perspective, it still is a learning process because we understand that, for example, many of the medical students' experiences have been interrupted. I think some of the letters that we're seeing reflect that the clinical exposure is not as vast as what we might have seen in the past. So I think we're trying to account for, you know, where we are relative to the times. And at the same time, you know, we've also evolved. I could speak for our program, and I'm sure everybody on the call has similarly made changes, but we've moved to holistic review of our applications, and we've done a lot of training for our interviewers so that people are, I think, honestly, in a great way, not being evaluated by the same sort of time, well, I wouldn't say time tested because I don't think it ever was really tested, but I think time honored ways of evaluating applicants. And I think what that's done for us has been to expand our sense of what a great potential resident can look like. And those are some things that we've been working on. I don't know if that particular thing was because of the pandemic or because of all of the changes, I think, that have necessarily come from social unrest over the past year. That's one of the silver linings. I think we're all paying attention to that a lot more, and it's certainly changed in both general surgery and cardiothoracic. And I think almost every specialty is seeing similar evolution.
And it's good to hear that, there was evolution that was happening before the pandemic, and clearly the pandemic has put us into hyperdrive with that as we think about our programs, how we review applicants, how we look at clinical experiences and opportunities. And I know that I just received an email earlier today from a student who had their third and now fourth year, interrupted by the pandemic, and they were trying to restructure their rotations and still interested in doing away rotations. And we'll talk about that in a second. But it's good to hear that programs are looking at this as a complex evolving process. Nicte, for you, what are you hearing from program directors as they deal about the potential uncertainty that comes with the application cycle? We know the information from ERAS is out, but program directors are still trying to figure out how to map out this upcoming season.
Absolutely. Thank you for this invitation. I hear excitement, and in a way, it's good that we had the experience last year of figuring out, a best practice for the new way of doing, connecting with applicants and doing interviews. I know one of the things our neurology program benefited from is learning from AAMC resources and other resources out there about how to best structure reviewing applications, setting up the team that will be doing interviews, how to standardize interviews so that there's less issues around technology, both for all the students applying and interviewing, as well as the people interviewing them, and standardization of questions. I'm happy to say our team presented on this at the last annual American Academy of Neurology annual meeting, and there was excitement from other programs too on how to build from that for the next year. So I know there is still not what we're used to, which is certainly hosting people here and taking them out to meals and really getting them to know them more closely, but we're doing as much as we can, leveraging on the technology.
Yeah, and I could say that there's probably some best practices that we're going to carry over and that are going to be a part of application seasons to come. And there's some things that we do want to get back to, because I think there is the importance of having that in-person component where students can be on campus, seeing our institutions, walking our halls, getting to meet the staff, because there's something of value there. But then there's also things along with the cost of applications and interviews and bringing students to campus, and the cost that the students incur as well as the programs that may have been shifted because of these experiences. So, pros and cons to the virtual space, but I think there's a lot of good that we could take with us moving forward. So I want to transition to a question for you, Nicki. This is something we talk about as advisors to medical students all the time. Is about away rotations. A number of students are interested in doing away rotations, but there's really a narrow window for students to do so because of the changes that are happening with VSAS and what the AAMC is allowing for away rotations. So how will away rotations be viewed this application season?
Yeah, so while away rotations, in the past pre-COVID have been incredibly popular, both so that applicants can discover firsthand what programs are like, but also sort of allow applicants to shine and work hard and show what a great fit they would be for the program. Because of COVID, last year, away rotations didn't happen at all. And applicants were not penalized in any way for that. There were some virtual actually visiting electives that went very, very well in some disciplines and specialties. And I think we were talking about best practices. Those will likely continue and may even be, available before actual in-person away electives are available, which were slated to happen in August. That's what we're being told. Hopefully that won't change, but that's what we're being told. So because it's such a narrow window, and again, this is just sort of my opinion from talking to other program directors, I don't think in any way applicants are going to be penalized or it'll be held against them in any way if you're not able to do an away elective. There are some specialties that in the past have required it, highly recommended it, like emergency medicine and orthopedics, but given the narrow window, I don't think that's going to be the case at all. So I wouldn't worry if you're not able to secure an away elective in time for your application to be ready on ARIS. There will be time after your application is in, so that if you are able to secure one, you still could be experiencing what that program is like once your application is in and before you even interview. But my personal view is that, and this is from talking to other program directors and other advisors, I don't think it's going to be an issue if you can't secure one.
Great. Thank you for that. And I guess that really leads to my next question for you, Nicte. So it was a great lead in by Nicki. If a student isn't able to secure an away rotation, for whatever reason it may be, what should they do in lieu of an away rotation?
Yeah, I mean, I think there's a lot that students can do. And with regards to their current sites, the hospitals that they're rotating at, being the very best at each of their rotations and trying to, go above and beyond in ways that maybe traditionally are less tangible. So for example, for the students who rotate with me when I'm on service, one of the things that I think is important is getting as much information from residents and fellows who've worked with them, or their attendings who've worked with them, so that we can embed those in the letters. So if and when you go do clinical rotations, and particularly if they're connected to the area of interest, the area that you're applying to, make sure you not only ask for a letter of recommendation from the person who's you're attending, but I suggest ask the residents working with you to send a paragraph to the attending that is gonna write that letter, so that letter can be fuller of information. The other thing is, for example, I'm a neurologist. If you're applying to neurology, but find an away rotation in psychiatry or neurosurgery or medicine or PM&R, all of those will be helpful. So with that narrow window, don't feel that because it's not the specialty that you're interested in, it won't go well. Whatever, if there's a connection, I think it will be helpful.
And that's a really good point about making sure that you think about the cross-pollination that happens in medicine. No specialty practices in isolation. And so whether your interests are in one particular field, there is some cross or overlay. I know in particular for emergency medicine, this past year, trainees or applicants were able to get letters of recommendation that were viewed almost in the same parallels, the standard letter of evaluation for their application from folks in surgery or internal medicine, because we recognize that there were limitations in this space. Sidhu, I have a question for you. How will students who are unable to do away rotations be compared to students who did?
Yeah, that's a tricky question to answer, because there's sometimes this concept of the devil versus the devil you don't. And I mean, to build on Dr. Johnson's reference to the virtual rotations, I think that is an opportunity. So even if you can't get away for a in-person rotation, or the timing just doesn't work out, or you're interested in places, I would really look closely at the opportunity to do even a virtual curriculum with a group to find out what they teach, like, what the residents maybe that you'll have a chance to meet are like, and it gives the faculty there a chance to meet you too. And so if you have the ability to do a virtual rotation, for example, in our general surgery match this year, 6 of the, I think, 10 med students that match with us came through our visiting rotation program. And, that's obviously a lot different than before, where maybe 4 or 5 of the matched residents would have gone through an in-person sub-internship. Again, I think that even if you don't do a virtual rotation, even if you don't do a in-person sub-I, I think program directors are going to take that into account and realize that it's unusual times, and we're going to need to make the best decisions based on the other available data. And so what are those? It's how you've done in your classes. It's how your personal statement looks and what kind of motivations are reflected in how you put that personal statement together. Everybody has their own little pet thing that they like to look out for. For me, I like to see people that have worked a manual labor job in their life. That's, I think, for a surgeon, that's kind of an important thing to understand, that you're not afraid to roll up your sleeves and get dirty, and you've had to work hard for what you've been given. I think personally, I find that a much more valuable experience than you had a lot of privilege and you didn't have to work a day in your life. I mean, I think for me, that's one of my things. And then I think your letter writers, which I think we will talk about to a lot deeper extent in a minute, but who you pick for your letter writers and what they capture about you is so hugely important, because we're going to really rely, if we don't meet in person, we're going to say, okay, what do you really think? And the secret that maybe people don't know about is, beyond the letter, there's often an email and there's a follow-up phone call. I mean, I do a lot of recon for people that look really good on paper, and even their letter, I'm not sure how to interpret all the code words, like they're whatever adjective they want to throw at it. And then I think, I'm not sure that they're saying what they really mean. And I call them up and they're saying, off the cuff, this is what I think about this person. So I think it's really important for you as a student to know your letter writer, for the letter writer to really know you. And then that information is going to be crucially important if you have not done an away rotation. So I don't think it necessarily puts you at a disadvantage, but I think you have to pay attention to the way your application is striking if you don't do a rotation at the place you want to go to.
And Sidhu, I'm actually going to stick with you because I have another question for you to build upon this. You're the program director for CT surgery at BI, and not every medical school has a rotation where students can do cardiothoracic surgery. And so we often call these, and not necessarily the best term, but we call them orphan medical students, because they don't have that residency program that they can do that rotation in and get that experience and maybe get those letters. And so how can students who are coming from, orphan medical schools do their best to impress program directors, especially if they're not able to do away rotations?
Yeah, for cardiothoracic in particular, I think it's, you can imagine, a really, really big gamble for a program director to want to take somebody that has never actually experienced the specialty, right? That, I think, from technical perspective, from a lifestyle perspective, really figuring out if somebody understands what they're getting into is difficult. And I'll be transparent. We at BIDMC don't have a CT residency which is integrated, in the sense that we don't take people straight out of medical school into an integrated or I6 program, meaning you start as an intern, you're rotating in general surgery, and then you very quickly move into a cardiothoracic training program, and the remaining 5 years you're spending really a disproportionate amount of time doing cardiac, thoracic, and probably a little bit of vascular. Our training program at BI is sort of the traditional pathway where you've done a general surgery residency and then applied to a 2-year additional training in thoracic. So I think for people that are in that situation, If you're, again, I'm skipping ahead because I think most of the people that are on this are going to be medical students. But if you find yourself in a place that doesn't have a thoracic, a hearty thoracic rotation that you're going to be participating in as a resident, then I think if you're able to find a year or 2 years to do some research or some other activity beyond your clinical training, that gets looked at very favorably. And during that time, you might get involved with the ECMO program, or you might get involved with the lung transplant procurement program, or some other ways that you can burnish your clinical chops. I think if you're a medical student and you're considering applying into cardiothoracic training without ever seeing it, I would advise you not to do that, because I think once you get into that without ever having done it, you saw it in a movie, or somebody said cardiothoracic is a great specialty to get into because X, Y, or Z thing, be it the immediacy of the treatment or whatever it is. I think you're making a mistake, to be frank, if you have not spent some time on that service. If you're able to do an away rotation and get some time on a thoracic service, and that is something that really resonates with you, that's different. And then you'd use that away rotation letter to help catapult you into an integrated program. But if you've never done a specialty, one of the first things that you're going to get asked on the interview trail is, well, why do you want to do this? And often we followed that up with, well, what have you seen? What kind of patients did you take care of? Remember, whatever specialty you go into, you've got to like the worst part of that specialty, like the mundane, the daily, the stuff that can be quote unquote a drag. I love everything about my specialty. And I think everybody on this call will tell you that you should go into their specialty because they love what they do. And even the thing I've done 1,000 times, 2,000 times, I love doing it. I'll do it again because that's who I am. But if you've never sort of experienced sort of the full spectrum of what a specialty looks like, what its most difficult patients are, what its most crushing defeats, the complications and the things that just don't go right. If you haven't had at least a chance to, sample that, I think it's a bit of a mistake to apply into an integrated program right out of medical school to do that.
And what I would add to that, just to wrap up this discussion around visiting clerkships, is, the goal is to make sure that you have exposure to the specialty that you're interested in applying to make sure you're making the right choice. And if you're coming from an institution that doesn't offer that, you may want to think about what the opportunities are available to you, or when you can possibly get exposure to that residency or that specialty. It doesn't necessarily have to come in the same traditional ways that we've had in the past, but you definitely need to have an understanding of what you are signing up for, because not only will residency be a challenge if you decide to go into a specialty and you don't have the greatest exposure, but also your career is not going to be as fulfilling as you would like it to be, because you're not necessarily happy should you complete the residency and move on to the specialty. So really think about what your outline of your year would look like. Consider what other options may be to make sure you get the appropriate exposure, and do your best to get an away rotation. And it may happen even after the submission of ERAS of your application. And we can talk with your mentors. You can work with your mentors and figuring out how to make sure that experience is incorporated into your application, so that program directors do know that you are doing a rotation in that specialty, and this is something you're committed to, even though it's happening after the fact that you've applied to residency. Speaking of ERAS, I actually want to pivot our conversation and start talking about preparing your application, whether it's STEP, whether it's letters of recommendation, talking about holistic review. And so the first question I have for you, Nicte, is how can students set up an application, and how can they prepare their application to overcome maybe a poor performance on a core rotation, or a less than ideal step 1 score, what they think is what the score should be?
Yeah. Nowadays, there's so many resources on how to, for example, format your CV or resume, as well as how to write personal statements. And I would say investing time in learning, how to make them shine as much as possible is really critical. I would encourage you, when you're thinking about your resume or CV, to really make sure you're including not just your training and your educational pathway, but if you've had any leadership roles, if you've had any volunteer roles or other community engagement roles, if you've participated in any research, particularly if you're presented posters, and if you haven't, maybe there's still time to submit abstracts to meetings that are related to the area that you're interested in. If you've written, and nowadays it doesn't necessarily have to be an original research article. There are a lot of journals that are taking opinion pieces and commentaries and things connected to your experiences as medical students during the COVID-19 pandemic, for example. So all of that, make sure that that is well represented in your CV. Sometimes we minimize things that we've done in our journey, and like Sidhu was saying, if you've worked in things outside of medicine, but that there are skills behind those that you bring to the table, make sure you're listing them. Same thing with languages. If you're fluent in a language other than English, fluent enough to care for patients or give presentations, make sure we know that. With regards to the personal statement, I think for the rest of our lives, you've already written one for undergrad and for medical school, and now it's the residency one. You'll continue writing them, whether it's for faculty awards or for jobs. And I think by now, you know that putting the right amount of time is important. If you have friends or other peers, mentors, advisors who can review it with time and give constructive criticism so that you build up on that. Take them up on it. I think it will only strengthen your work. And just a very general thing, try to not replicate what's on your CV. Try to bring that extra information that isn't visible on the CV. What drives you to the field, what you bring to the table, why you in that specialty.
Thank you for that. And we're going to talk more about the personal statement in a second. I think it's just want to double down on the importance of making sure that your application is as complete as possible before you hit submit, whether it's having your abstracts listed out or making sure that you list all of your hobbies and activities, or making sure that you are thinking about your other experiences, whether they are prior to medical school, including research. You can make sure you include that as well. Or other publications or presentations, or your leadership work that you may be doing, whether it's involved in the Student National Medical Association or Latino Medical Student Association, or other interest groups that you may be a part of. But making sure that information really helps to tell your story as a part of that ERAS application as well. So the question for you. Students are going to be applying, and access to testing sites has been limited over the pandemic. Some students are going to be applying and they may not have their step 2 scores. Is that going to have an impact on their application? And if so, what do you think is going to be the implications?
I would imagine that each residency program you apply to is going to have its own sort of in-house rules about this. I just want to take one step back and just say, you are not your standardized test score. So remember that as part of this. I just have to get that out there because your test scores do not reflect who you are as an applicant in its entirety. And hopefully the types of programs you apply to are going to also understand that. So I know at our program in general surgery, where the step 1 and step 2 would be relevant, we obviously need a step 1. And I think most you're not moving on in medical school without having taken that. But we don't require that the step 2 is completed by the time you by the time you make your application. Before you start internship, your step 2 should have been completed. So for us, it's not a barrier if you don't have that. The way we look at it, if you do have it, let's say you have step 1 and step 2, And currently the step 1 is still scored. It's not pass fail. In our holistic review, we take the highest score of those 2, and then we use that. And we've, I would say, to some extent, devalued the step scores and valued other things like commitment to community service or healthcare disparities research or leadership, as was mentioned prior. I mean, to try to make sure that we're encompassing a whole lot more than the test score. Now, I'm not going to lie, if you have a very high test score, you're still going to get points for that test score. But if it's step 1, great. If it's step 2, great. If you haven't taken step 2, then we use your step 1, and it shouldn't adversely affect your chances of, matching.
And I would like to say that each residency program has their own formulas that they use, and they have their own way of doing a holistic review. Some programs may be a little bit further along than others. I think it's great that your surgery program looks at both step 1 and step 2 and takes the highest. There's always questions that flood our inboxes about, well, what's the cutoff? And really, it depends, right? And whether or not step 1 or step 2 is valued by the program director and by the rest of the reviewing team. But then there's also other factors that come into play. So just to double down on what you just said, your step 1 score, your step 2 score does not define who you are as an applicant. It's a part of who you are. It's a part of your application. But for you all who are concerned about a specific step cutoff score, it depends. Everybody has their own secret sauce or their recipe that they use, but make sure that you are putting together the best application that you can, which happens to include your step scores. Nicki, I want to turn to you because Nicte talked a little bit about the personal statement, but we really need to pin this down a little bit more. And so what are your thoughts about what students should be including in their personal statement? And I guess the more specific question to this is, we all have been through this pandemic. Everyone wants to potentially talk about COVID. Should this be something that students are talking about as a part of their personal statement? And to what degree should they include this as a part of their personal statement?
So for a personal statement, it's really a time when you can introduce yourself to the program and the program director. It's your opportunity to, the first window into getting to know you as a person. And this goes above and beyond what's on your CV. It's not just what's written out in a list form on the CV. So it's your opportunity to talk about what shaped you, about your journey. Many medical students start off with something about their family, about growing up, about a work experience, about a patient experience. And then you go on to talk about why you chose your particular specialty. What's your passion and how did you arrive at that? And there's many different ways to do that. And then in the last sort of wrap up, usually most students talk about what they're looking for in a program and what their future career goals are. And it can be in very vague form. So, as an example, some students talk about being on a sports team, and about how that taught them about hard work and being able to multitask and being able to make decisions quickly and working as part of a team, and how that lent them to wanting to go into their particular specialty. Some students talk about their experience, growing up and wanting to take care of the underserved populations, whatever it may be. You're talking about what shaped you and who you are. And the goal being that the program director says, I really want to meet this person. So having said that about COVID, we've all experienced COVID and it's affected every single one of us. But I guess my advice would be, unless it in some way helps to tell the program director who you are as a person, I wouldn't necessarily include it. So for example, one of my advisees who's going into OBGYN during COVID, when she was taken out of the hospital, decided to volunteer and called and participated in telehealth visits for postpartum patients. And not only was it an incredible experience for her, but it further solidified her interest in women's health and passion for women's health and OBGYN. Another one of my advisees is going into pediatrics, and she actually wrote a children's book while she was out of the hospital and doing virtual learning. So in that respect, it really was impactful in shaping them as people and helping them decide to go into their respective fields. So I guess that would be my advice, that certainly include it if it in some way completes your journey and helps the person reading it say, God, I see how this person is so passionate about their field, and how and why they want to go into it. And I really want to meet this applicant and potentially have them be part of our program.
Thank you for that. And back to you, Sidhu. Letters of recommendation. Can you talk a little bit about what you are looking for when you're reviewing letters of recommendation? Specifically, what should students be doing to engage potential letter writers, and how they can make sure they get the best letter of recommendation from an individual?
I think it's good that you don't need a single letter of recommendation, because I do not think that a single letter writer can fully accomplish what we get as program directors when we look at the letters. So, and let me say, for surgery, there's an additional thing that needs to go in letters, which I think is useful, which is it is important for whoever's writing your letter to speak about whatever technical skills they might have observed and what your potential might be with regard to that. So, so that's one of the things that we look at. Then you need to make sure that you have a letter writer who's a surgeon that has let you do some stuff in the operating room and can say, hey, this person has a lot of potential. I've operated with him or her many times. And, I think, her skin closure is as good as I've seen anyone in the last 10 years or something like that. I think that's an important thing. But stepping back, I think, the strategy for sort of getting your spectrum of letter writers, ideally, you have people that really know you, and you have people that have some degree of connectivity across the field, so that when we get a letter, we know whether we can trust it or not. Sometimes those can be the same people. Sometimes the people that you really work with also happen to know somebody in the place that you're applying to, but often they're different. You might have somebody who's more junior, but worked with you very, very closely on your rotation, and they can write you an exceptionally strong letter filled with details about your performance and who you are as a person, but that person might not be well known. So I think if you're going to have somebody that's like that, who may be not as renowned within the field, if you're able to then counterbalance that with somebody who, on a national level might have a bit more prominence, whether it's a division chief or a department chair or a vice chair at your institution, I think that can be useful. Another thing is, if you know that there's a particular residency that you're interested in, and you know that one of your faculty is a graduate from that residency program, I think that also can be a useful letter writer. I think in general in surgery, we like to see people that have written letters that are also surgeons, but that's not exclusive by any means. A lot of the students that we evaluate are very interested in academic surgery, which means that they spent time in a lab or some other research setting. And very often the person that's writing that letter might be a PhD or might be a professor of immunology or something else. So we will look at those letters very closely, but you can't have all of your letters outside of your specialty, because I think then you wonder, somebody might wonder what you're hiding within the surgical world. But I think a good balance of people that really know you plus people that have some connections, because at the end of the day, we're taking a gamble on you as you are taking it on us, and you're going to do your due diligence and find out from other residents or people that used to be faculty at a particular institution, like, what is it really like there? What is the culture? What's the vibe? And we try to get the same intel on you. And one of the ways we do that is by assessing the types of people that are writing your letters. So I think that, it's really, really important who you choose to do that.
And I like the strategy that you offered on trying to identify individuals who may have a relationship to programs that you're highly interested in. So if you have faculty at your institution who trained at a residency program where you're interested in going to, having that additional letter from that person will maybe provide more insight to the program director about who you are. One of the things that I encourage students to do when they're putting their applications together and getting letters of recommendation is to put together almost like a packet for the program, for the person who's going to be your letter writer, including your application or your CV, including your personal statement, and maybe giving them some bullet points as sort of things that you would like for them to highlight that really talks about your relationship with that individual and what points of reference that you would like for them to emphasize. You're not writing the letter for them, obviously, but you're helping the letter writer to be in the position to best write a strong letter of recommendation for you. Before we move on to learning about programs, actually, Nicte, I want to toss a question back to you because it seems like you opened up a can of worms with students asking questions about research. There's been a couple questions to come in about students, whether having unpublished research be a part of their application is important, comparing that to research that's been published versus things that were submitted for abstracts and accepted to conferences, but not written up yet formally. How does, and then do students even have research as a part of their application to residency? So just would love to hear your thoughts or insight about the value of research when students are applying to residency.
I'm biased, but I think research is cool. And it's always a good time to get started if you haven't. So if there are opportunities to work with people around you to do research, it doesn't have to be perspective and case control. You can start with simple things like retrospective case reviews, or if there's someone who uses public data sets and is has a very specific question and has already made progress to the degree that you can do a specific analysis. I would encourage you to do that. With regards to how complete with regards to publishing things need to be, my recommendation, once you become a resident, you will be very busy, in a way busier than in medical school. So as much as you can make progress, this will benefit you, because it will be something that you will be able to take with you forever. So doing the work, but not transforming it into an abstract, a poster, a publication, unfortunately, it can be disappointing down the line that you put in all that effort and that you don't have it for years to come. So my suggestion is, if you have something in the works, try to submit it somewhere as an abstract. If you have an accepted abstract, or if you've presented an abstract, now is the perfect time to get writing on the manuscript and partner with your mentor to make sure that it's you go through it quickly, you submit it efficiently, and by the time you interview, there may be progress. Maybe that abstract that you submitted is now accepted. Maybe that poster that you presented has now been submitted as a paper. So the more progress you can do, I think, the better. Listing a lot of research projects in the works without abstracts or manuscripts may not be necessary. I know exactly what some of the comments are about, and I think I would focus on, even if it's just one thing, making it into an abstract and then later a manuscript is very helpful.
And just one key piece of advice for students: if you're going to put research into your application, be prepared to talk about it. The last thing you want to do is say that you were involved in a research project, overstate your knowledge about the project or your role in the project. And when somebody who is interviewing you asks you a question about the research, you seem unprepared. I think that tends to be a red flag for a lot of us in academic medicine, especially if you happen to be interviewed by somebody who shares a research interest with you. Just something to think about. I want to transition now because we're seeing a few questions come in about learning about programs. And so I have two questions. One, I'm going to stick with you, Nicte. when students are trying to show that they are interested in a program, maybe they're coming from across the country or they're coming from a smaller, newer medical school, but they're really interested in a residency program. How should students go about expressing that interest in a residency program?
Oh, that's such a great question. And I think there's two parts. One, so let's say hypothetically, you're interested in neurology. Hopefully you are interested in neurology. Some of that interest can be expressed indirectly. For example, you may be part of your sign chapter at your medical school, or you've become a member of one of the national organizations, which often are free to apply for medical students. So check out those national professional organizations. And then when it comes to saying, well, I'm actually interested in your specific program, I think there's different ways. One is certainly reaching to the people listed on the website, whether it's the program coordinators or the program director, and introducing yourself and saying that you're planning to apply for this season. I think it's always helpful to do some background research on the program and the person you're reaching out to, and not necessarily ask the questions that are already answered on their website materials. The other part is in your medical school, there may be people who either graduated or are still there who may have connections in those programs. And I think those type of reaching out to friends of friends or friends of colleagues or alumni of your program is also very helpful, because then they can be connecting you to others that are connected to the residency program.
Wonderful. And Nicki, I have a question for you, and it's about reaching out and sending those emails that Nicte was just talking about. Is there value in reaching out to the current residents in a program or faculty, not necessarily the program directors, to get an understanding of a residency program?
Yes, absolutely. And I think even more so that we have limitations on away electives and second looks and things like that. So reaching out to current residents is a great way to find out what it's like to actually be a resident at that program. So the residents are the heart and the soul of any program, right? They're who you're going to be working with. They're going to be your colleagues. They're going to be your support system. So asking the questions that, again, was already said, that are not available on the website. Like, you don't necessarily need to know from a resident, how many vaginal hysterectomies do you do? But what you want to know is, what's it like to be a resident? What kind of mentorship do you get? If a research project is required in your residency, do you feel like you get adequate support and guidance about that? Are you supported if you were to need a leave of absence, have family emergencies, whatever might be pertinent to you? That's where you get those kinds of questions answered. And you also get a sense for, how happy that particular resident is. I mean, if they can't even make time for you, that might be giving you a little window into what that program is like. If they're so excited to talk to you about their program and they're sort of bragging about it, that's a really good sign. Residency is hard, as been said before, but there's definitely a difference between hard and happy, and hard and kind of miserable and burnt out. And so you can get that sense from talking to residents. Talking to faculty is also another way to get at sort of the pulse of the program. You may decide to reach out to a faculty member that has a particular interest of yours. So for example, let's say you're interested in global health, and there might be a global health faculty at one of the programs you're applying to, reaching out and saying, just wondering what sort of opportunities there are for residents to experience global health, what kind of mentorship is there? And asking, again, specific questions. And if you get the sense, again, that this faculty member is really eager to talk with you and sort of brag about the way that they mentor and shape residents, that's a really positive sign about what that learning environment is going to be like in that program, and what it's going to be like to be a resident. So I highly, highly recommend it, especially given this current interview season. There likely are not going to be any in-person dinners, the events before where you get to sort of casually talk to residents, especially. So reaching out via email, setting up Zoom, especially so you can see facial expressions, might be really, really helpful. The other thing it does when you reach out is it does show interest, right? You're going that extra mile to really find out what it's like to be at that program, and people are going to take note of that. They're going to remember that you did that.
Great, thank you for that. And just to highlight a point that Nicki mentioned at the very beginning, is that program directors can only have certain amount of conversation with you, and they tend to really pull back, especially during interview season. So if you're trying to get information from about a program, you know, your sources, high quality sources, are going to be from those residents who are in the program and from faculty who aren't necessarily involved in the interview or the residency selection process as a program director or assistant program director may be, especially after, you know, the ERAS submission deadline, because program directors don't want to send mixed signals to you all as applicants. So just understand that your better sources of information may be from those other faculty, especially if you have a common interest. And my last comment that I'll make is just be wary of websites and blogs and other sites that espouse information about insider information about programs. Not all that information is accurate and it can't be vetted. And really for you is to go to sources like webinars like this, in reaching out to faculty, as opposed to going to chat rooms and forums and seeing what people are posting about residency programs, because that's really can be a place that's fraught with a lot of misinformation. Nicki, I want to stick with you because you're our OBGYN representative here, and recently the OBGYN residency programs committed to virtual interviews for this season. And so what should applicants be doing to prepare for virtual interviews for this application season?
Yeah, so it was just announced that our lead professional organization on education has recommended that all interviews be conducted virtually for OBGYN, including for local medical students. So at your own institution, even though obviously you could be in person. So likely almost 100%, if not 100%, will comply with that. So what I would recommend is for sure talking to students who have just gone through this process. They're going to be a really good source of information about what it was like. And I can tell you from personal experience, last year went incredibly well. And in talking to students who went through it, they actually felt like they could really get a sense of what the program was like, even though it was all virtual. So I think hopefully you're encouraged by that. And we certainly were. And I think in many, many fields, people were pleasantly surprised. So I would suggest talking to your peers who've just gone through it, who've matched what it was like. The kinds of questions that you're going to be asked are very similar to what an in-person interview, actually. Typical questions about getting to know you, why you want to go into the specialty. You've probably heard of behavioral interviewing, where a certain trait of an applicant wants to kind of be probed. So for example, if being a team player is an attribute that's considered very important in your specialty, for example, OBGYN, then you'll be asked a question that would demonstrate that you're a team player in some way, or for example, work ethic. So whatever that might be, and that's still able to be done in the virtual platform. So the question types we found were very, very similar. The way that interviews are structured, if it's an applicant with 2 residents or an applicant with 2 faculty members, that can still all be conducted virtually. Super important is to make sure that you're ready for it. And if your school offers mock interviews, I would definitely take advantage of that. You could also do it with residents if that's available to you at your institution, but you definitely want to do something to prepare you so that you can get feedback on, how do you present on camera? Are you looking at the camera? You want to think about your background, think about Wi-Fi, all those kinds of things that you're probably already familiar with from doing Zoom lectures and things like that as part of your classwork are important for the interviews. So practice, and it'll help with the virtual aspect, but also the content, which we've always recommended mock interviews for the content piece of it. But I think practicing to get that extra piece of feedback about how you present yourself in the virtual platform is very important as well.
Thank you. And I'll toss a question to Nicte in a second about backgrounds and interviews because I think that's a great place of discussion. But I want to go first to you, Sidhu. You mentioned that CT surgery was doing virtual interviews in the past, and general surgery obviously last year did virtual interviews. Do you expect that other residency programs are going to be transitioning to either some or all of their interviews being conducted virtually? And what do you think for specifically for this year? What are your how do you anticipate the year to go with virtual interviews?
Yeah, that's a really good question. I wish I knew the answer to that because I feel like there's so much to sort of deal with. There's a real arms race when it comes to applying to residency, and of course, you've spent all this time, all this energy, emotional, psychic, mental, and everything else in becoming a doctor, and you want to maximize your chances of getting a residency spot, right? So of course, people are applying to what I look at, and I think is just a preposterous number of residencies. I mean, people are spending thousands and thousands of dollars, which most of us don't have, at that stage of our lives, going around the country and applying. So, there's a part of me that hopes that virtual interviews will be here to stay because it gives people a foot in the door that they might not otherwise have had, either because of their own financial limitations or programs because it's difficult to have that many people in person might have restricted it. And so we, for sure in our virtual interviews, I think we interviewed something like 45 people for 2 spots. And, that's a lot in cardiothoracic, and that's a lot. And we did that because, you just add a couple more people on our Zooms and, that works out pretty well. I think that if there can be reform in the process so that you're not curtailing people's access to places and you're not limiting their options, but you can make it a little bit more fair. So the top, quote unquote, top 10% of candidates don't scoop up all the interview slots and everybody else is fighting for the remaining slots. That would be good. But I would hope that, at some level, virtual interviews would be here to stay. I think that I think it was mentioned, I can't remember who mentioned it, but the AAMC has a lot of guides on how to make that a more fair process. I think that's a really important part. I think that, people that are interviewing, we're doctors, right? Primarily, we didn't train in HR, and we didn't train on how to get the most out of an interview. So I think it's important that people that are doing the interviews do have some training in that, and the AAMC resources are important. But I think that it allows us to take a look at a lot more places. It allows places to take a look. I mean, the applicants to take a look as well. So hopefully it'll be part of how it's going to work. I suspect that we'll do it by next year when cardiothoracic interviews again. I would imagine that we'd have some element of virtual, but have some element of in-person still.
And I would just say that this is a space that's evolving. The guidelines that were presented from OBGYN residencies was definitely ahead of the curve. In other residency programs, educational groups are trying to decide what they should do. But you have to watch the space, something to consider. We recognize how this allowed students to be more engaged in the process, and students were interviewing more because of the lack of the barrier related to travel and cost. But we also recognize there is an importance of being in person on campus, and the value added of seeing a city, seeing a hospital, walking the halls of the institution, and what that offers applicants as well. So there's some evolution that's going to happen. And then also we have to see where we're at as a country when it comes to travel, and where we are as a country when it comes to distribution of the vaccine and safety, and what states are going to be doing that may be different from one state to another, and how that may restrict travel. So a lot to consider. This space is continuing to evolve. We're talking about this very early in the process, as you know, because interviews won't be happening until October, November, December, and January. So we're a few months ahead of the curve, but we just want to make sure that you all are thinking about this discussion as you start to plan and hopefully save, because the cost of the application process for residency. Nicte, before we move on, I do want to have a conversation just about virtual experiences in interviews, and if you have any insight on how people can maximize their appearance. I have a pretty bland background. You have a wonderful background. How does that come into play? Or are there cues or things that students should be thinking about when they're trying to put themselves in a position to look great for their virtual interviews?
Right. So the AAMC has nice resources, both for programs and for applicants, on how to navigate virtual interviews. So I encourage you all to check those out. In my mind, the most important thing when you're interviewing with programs is that they can listen to your answers, because that's really what the focus of this is, learning more about you. So I think a key piece of technology is making sure you have a good microphone and that you're in a quiet space. A lot of the times the headphones tend to be better. Lighting is always good, and if there's any natural light that you can bring in, light behind your computer. I have to say, the background, I think the most important thing is you. And whether it's a white, wall, whether there's things behind you, like in my case today there are, but not every time, or maybe your medical school has offered a virtual background, or even the program you're applying to. So I think all of those are valid. I know that all of us live and work in different spaces, and that, don't feel like you have to go out and buy a lot of new objects to make the place pretty. It's certainly welcome, but I think the focus should be you, and bringing content that is meaningful for the programs to know you more. The other part is on internet connection. I know that that's a big one, making sure that you're on Wi-Fi and having a backup. So if your computer doesn't work, do you have Zoom on your phone, and can that be your backup? And if the video doesn't work, can you then switch over to phone? So those would be my top things, but check out the AAMC.
Yeah, great resource that you mentioned available. And what we'll do is we'll try and post that link to our website, and hopefully we can put that in the chat as well, just so students can be aware of that information. I want to open it up to all the panelists now. I have a couple questions from the audience that I think are important that we haven't touched on. But one question that I actually have is, I'm going to go to you, Dr. Johnson. Because of the pandemic, we had students that were applying to or over applying to residency programs, and we are seeing students applying to way more programs than they would have in the past, because they were unsure of what their success rate would be with getting interviews and successfully matching. How do you advise students to go about and put together a realistic list of the number of programs to apply to? What do you consider in that formula? And how do you encourage students to be thoughtful about the number of programs that they apply to?
Yes, that's a really good question. Yeah, we unfortunately in all specialties have seen an increase in the number of programs that applicants are applying to. It's this overinflation of applying, which is negative for applicants as well as for programs. It's a lot for program directors to have to sift through, and it's a lot for applicants. And then it sort of has this negative effect for the whole system, in that then students who might really want to go to a program are impacted by other students sort of taking their place, and they may not have the intention to even go there. So what I would suggest is, taking a step back and really thinking about, where do you really want to apply? Thinking about parts of the country, types of programs, size, closest to family, whatever the case may be. And then similarly to how you applied to college, how you applied to medical school, thinking about having some reaches, some matches, and some safeties. And that's where talking to your advisors, talking to people at your medical school can help you do that. But not to just apply to a program to see, oh, can I get an interview there? You know, really dig deep and say, do I really want to go there? And if I got an interview, would I actually go? And if I get the interview and I like it, would I actually apply there? Or am I kind of just doing it sort of because it's a great program and I just want to see what it, you know, if I can get an interview there, because that's not helpful to you or to the whole system as a whole. There definitely are guidelines, and again, refer to the AAMC. They have these really, really helpful tables and charts that can show you that when you reach a certain point, and it depends on which specialty and how competitive, but you sort of reach a point of no further returns. So for an OBGYN, it happens to be at about 12 to 14 programs that once you rank that number, you don't increase your chance of matching. So you want to know what it is for the specialty you're applying in, and then to be realistic about it. Under normal circumstances, applicants can't interview at more than typically about, at the most, like 20 programs, because you're flying all across the country. So you want to think about that in the virtual setting too. You know, what's realistic, and it's not helpful to over apply and then be canceling interviews, you know, at the last minute. So would say to just be very, very mindful and to be realistic, and really think about where you want to go and where's realistic you're actually going to get an interview and then might actually match there. And that's where talking to others who know you well and know the system well and know your specialty well can really help.
Yeah, and I think you said some really great points in that. And I think one of the things that students really need to do is take advantage of the resources that are coming out from trusted sources like the AAMC. I think those charts and graphs that you mentioned are really helpful for students, and they break it down by other factors, including step scores, which I know a lot of people get hung up on as far as, you know, number of programs you should apply to versus your step scores, and they put you into different I think different thirds, correct me if I'm wrong, Nicki, but it's just really helpful in graphic, you know, it's really helpful to see those graphics as you think about what you're interested in and where you're applying to. So I have a question for you, Sidhu. There was we talked about reaching out and talking to program directors and having conversations with them about their residency program. You know, is this something that students should be doing because they're not able to do those orientations, and how should they be engaging those program directors? This is before the interview process, obviously, but you know, is there value in having these conversations specifically with program directors?
I don't know that in advance of the application and the interview coming through that there's a lot. I mean, from my perspective, and I'm sure the other panelists have the same, I get emails, I get too many emails already. So when I get an email from somebody, I have no context. I don't see their full application. I don't know who's going to be writing their letters. I don't know what their transcript looks like. I don't, know any of that stuff. And honestly, if I get it well in advance of receiving their application and reviewing their application, I probably will forget that I even saw that letter. The follow-up stuff I think is a little bit different, but the in advance letter to sort of prepare me for the receipt of an amazing application, I think is probably, for me at least, less useful.
Wonderful. And Nicte, as you are interviewing applicants, are there questions that, what are the typical questions that you hear about from applicants? And are there things that applicants should be really pushing to get answers from, or there is some topics that may be better left undiscussed during the interview?
That's such a great question. I think this is a wonderful opportunity for you to learn more about the program and its people from beyond what's already on the website and any other information that has already been shared with you. So be mindful of that. I think if there are things that are already known publicly, skip those and dive deeper into things that may be important for you as you start your residency. How is teaching organized? How clinical rotations go, how electives go, if there are opportunities to do research, away rotations, international rotations. Think of things related to living in a place, particularly if you've not ever been to that city, things around cost of living. I think it's certainly a good thing to ask about family if you have specifics. In our program, I'm very proud that a few years ago the female residents put together a program where if you identify as a woman in neurology, you can connect with women in our program and ask, outside of the residency interview group, ask questions about anything. And a lot of the questions may have to do with kids and childcare and where to live. I know as someone underrepresented in medicine, a lot of the times there's also opportunities to connect with people around. So tell me about the food out here. Will I be able to get the ingredients I'm looking for at the market? What are the type of restaurants that are around? Tell me about, how inclusive the city is and what challenges there may be for residents. Know that at a lot of the hospitals, including at Mass General where I work, there's a Center for Diversity and Inclusion, and that's also an excellent resource to connect with others who are underrepresented in medicine, both faculty and trainees, and get some more of that nitty gritty. So I think, with regards to, are there things that you shouldn't be asking? I don't think there's anything specific beyond if it's already known, skip that and focus on things that may be more relevant.
Yeah, I really think it's important to have those thoughtful questions ready in ahead. And I agree with you. It's really important to think about the quality of life aspect of it. We don't practice medicine in a vacuum. We don't live in a vacuum. We're not always going to be in the hospital. So it's really important to get an understanding of what the community is around you, what the support systems are going to be. And are you going to be happy as a person for the time that you're outside of the hospital and not doing your clinical work?
One thing that I would add there too is also about policies and benefits that you may have as a resident. For example, in our program over the last year, now 2 years, the parental leave policy has been updated, and it's a wonderful tool, resource to learn more about that maybe not all programs will have. So asking things around, life as the 4 or 5 years or more of residency progress, and what things would look like at a specific program.
And so, a question for you: the value of participating in virtual clerkship, not visiting clerkships, not in-person clerkships, but actually, if your program, you mentioned earlier, you all did a virtual clerkship, and so should students be looking for those opportunities and how they can maximize their exposure to residencies?
Yeah, I think that's a great idea. If you're able to carve out the time to do it, it can be really useful. And I think even for I think there was on the Q&A a question about international medical graduates, and one of our virtual clerkship students is an international medical graduate, and she matched with us in a categorical position. I'm not going to say it was only because of her experience in that 1 week, because clearly it wasn't. She was an amazing applicant, but it was also nice to meet her and see how she thought on the fly, and in the sort of didactic conferences and her presentation and going through clinical cases to get a sense of what her thought processes, what they look like. And so I think if you have the opportunity to demonstrate who you are, I would take advantage of it. I mean, I think it's really important, when you're thinking about all this stuff is, when you apply to medical school, you're trying to go to, quote, the best medical school, and then you're going to factor in a bunch of realities, right? Like where you want to live and the type of environment it is, and the cost and many other factors. When you're applying to residency, I think it's really important to understand what the residency's goals are as well. For med students, the goal is to churn out the best finished product possible. And so that's what you're going for. But in residencies, if you are not truly interested in doing academics, don't say you want to be an academic surgeon or an academic neurologist, or, you know, I think you don't want to shoehorn yourself into what the program is looking for, because it becomes very apparent that you are not that candidate, and you're not going to be happy if you go to a place that's requiring you to do things that are beyond your scope or your interest level. If you, and I'm not going to say just, because a lot of people will say this, like, if you want to just do clinical medicine, that's not a good way of putting it. If you want to do clinical medicine and you don't want to do all the other stuff that goes around with academics, then there are certain programs that are really looking to finish academic trainees. And so those are probably not good ones for you. Great,
thank you for that. And then, you know, I want to wrap it up with one question to Nicte, just talking about creating a rank list. What should students be thinking about? Interviews are done. They've had amazing interactions with programs, and they're now looking to create their rank list. Is there any other thoughts on what students should be looking at when they're creating that list, trying to decide where they're going to spend the next part of their medical training?
You take me back many years. And my suggestion is, it's very important to think of what really matters to you and be authentic in that kind of soul searching. Is it, you know, that you need to be in a certain part of the country? Is it that a program offers certain opportunities that really caught your eye? Is it that you really enjoyed engaging with people during interviews, or even after that, if you got to connect with other trainees? So I think at the center of this is you, what your needs are, what your hopes are for the next 4 years, and knowing that you know, this is one step in your journey. That after that there may be fellowship, and after that there will be jobs. So this is not the last decision you'll have to make about where you will spend your time.
Thank you. And just want to go quickly through each of our panelists. Just a last piece of advice for students who are joining us today. And I'm going to go out of order. I'll go with you, Dr. Johnson, first. Last piece of advice for students as they enter into this application season.
I would just say that it is a stressful process, but try and have fun with it. Try and think about it as a really exciting time in your life where you're finishing medical school and all that you put into it. And, you know, think about your application as a way to put your best self forward and really shine and really, you know, brag about what you've done and who you've become and what you have to offer. And in completing that application and writing your personal statement, you know, have others look at it. You're not doing this alone. There's advisors at your school, your peers, clinicians and mentors that you've met along the way that can help you and review it and help you put your best foot forward. So ask a lot of questions and try and have fun with the process, and try really hard not to take it personally. It's hard when you don't get an interview offer, and it doesn't necessarily reflect on you as a person at all. It's part of the process, and you can't control what a program is looking for. You know, it may be that there's, you know, 100 applicants who want to go into global health in a certain specialty, and they just can't interview everybody who wants to go into global health. So try really hard to not let it affect you. I know easier said than done, but just try to think about that and know that you're not alone, and reach out to try and get advice and help along the way.
Great answer. Dr. Gangadharan.
Thanks. I think, first of all, congratulations to everybody. If you're in medical school, you have accomplished a lot already, and you should also be congratulated on making a tremendous decision. Whatever specialty you go into, at the end of the day, you're helping people, and there is really no greater reward. So I think go into it with that confidence. You've done great things. You're extremely accomplished. And that confidence will help you through this process. Prepare to be extremely humbled once you get into residency. The learning curve is immense. And so you've got to find that duality. You know, you need to think of yourself as amazing, and you have to accept the fact that you're nothing all at the same time. And if you can hit that balance well, you're going to achieve really great things.
And Dr. Mejia.
Yeah, everything said already resonates with me. Enjoy the process. I know it is a challenging process, but every bit of it is your process. So enjoy it, make the most of it, make friends. I have good friends from the interview trail where we actually didn't even match at the same program, but every year we see each other at you know, national conferences, and we remember back when we got to interview. So as you meet people, keep those connections and know that, again, this is a little window into programs around the country, that when you are at the next step thinking about fellowship or thinking about jobs, you will already have some knowledge about what places look like and what places you liked. So enjoy it, and know that we're a community that's out here for you. We haven't touched up on social media, and I'd encourage you, if you're not on you know, medical student Twitter, Med Twitter, some of the specialty Twitters and other of the social medias, they're an extra layer of community that's out there.
Wonderful. And that's something we could talk about at a later point. But yes, Med Twitter is a great resource and a great way for students to start to build their network even at this stage. And so I want to say thank you to our panelists. We do have a quick survey that we want the participants to, excuse me, our viewers to complete. So if you could just click through these questions very quickly, that'd be helpful. As you can see, some of our Twitter handles are on the side. If you're interested in engaging us in social media, you can find us on Twitter, and be sure to look at some other upcoming events that we're going to have as a part of the discussion around applying to residency as a part of the visiting clerkship program. We're going to have some webinars starting specifically related to specialties, including internal medicine, pediatrics, during the month of May. We're going to touch on other specialties over the course of the summer. Be sure to sign up for those webinars if that's a particular specialty of interest. More information will be available at the DICP website. And also we have two other conferences that are going to be happening. May 4th through the 7th is our Leadership and Faculty Development program. And then May 25th, we're going to continue our Equity and Social Justice lecture series, talking about the education and achievement gap due to COVID-19. I want to say thank you again to our wonderful panelists. Thank you to Jasmine in the background for pulling this together, and to the students, good luck in this process. The webinar will be put up on our website and on YouTube for you to review. If you have questions, feel free to reach out to us. And thank you, and have a good rest of your day. Bye, everyone.